What hope does gene editing give for cystic fibrosis patients? What hope does gene editing give for cystic fibrosis patients? This question is becoming increasingly relevant as research progresses in the field of genetics. Cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane conductance regulator gene, commonly known as the CFTR gene. These mutations lead to the production of a defective CFTR protein, which is crucial for regulating salt and water balance in cells. This malfunction results in thick, sticky mucus buildup in the lungs, leading to severe respiratory issues and other complications. Current treatments primarily focus on managing symptoms rather than addressing the root cause. While CFTR modulator drugs can help some patients by improving the function of the CFTR protein, they are not effective for everyone. About 10 to 20% of cystic fibrosis patients have mutations that do not produce any functional protein, leaving them without effective treatment options. Gene editing technologies, particularly CRISPR and prime editing, offer a new avenue for treatment. These methods aim to directly correct the mutations in the CFTR gene at the DNA level. Researchers are exploring two main strategies. One involves adding a normal CFTR gene to compensate for the defective one, while the other focuses on fixing specific mutations directly. A significant challenge is delivering these gene editing tools effectively to lung stem cells. To overcome this, scientists are developing inhalable platforms that use lipid nanoparticles to carry the editing machinery deep into the lungs. This innovative approach could potentially allow for a single treatment that permanently corrects the genetic defect, halting disease progression and significantly improving lung function. While these gene editing therapies are still in the experimental stages, they representing a transformative shift from merely managing symptoms to potentially curing the disease. This is particularly hopeful for patients with mutations that do not respond to current therapies. However, it is essential to acknowledge that challenges remain. Ensuring the safe and effective delivery of these treatments, assessing long-term efficacy, and providing equitable access are critical areas that need further research. Genetic testing and counseling are vital components of this journey. They help patients and families understand their specific mutations and how they may respond to future therapies. This personalized approach is crucial as we move toward more targeted treatments. In summary, gene editing holds significant promise for cystic fibrosis patients by addressing the genetic cause of the disease. As research continues to advance, there is hope for lasting improvements in the quality of life and survival for many patients who currently face limited treatment options. This optimism is grounded in ongoing scientific discoveries and the potential for innovative therapies that could change the landscape of cystic fibrosis care.